Good evening. So first, let's go quickly with the quiz. So on the basis of the discussion of yesterday class, we will solve the quiz quickly. Question number 1. The cavernous sinus is located on either side of which structure? What is the answer?
Pituitary.
Pituitary.
Yes, very good. So the cavernous sinus is located all around the pituitary. Right side, left side, anterior side, all around. Which cranial nerve is most commonly affected in cavernous sinus thrombosis? If there is
What is this thrombosis?
whatever thrombosis means,
Left.
we can consider some condition, some blood clot, okay, something like whatever the condition, you can consider this. Any problem of the cavernous sinus, which cranial nerve is getting affected?
B.
A
Abducent.
A.
Abducent.
Nerve.
Abducent.
Abductor. No. 6.
So thrombosis means we can
Blood clot is the thrombosis.
Blood clotting.
so this image we can see. So the thrombosis means the formation of the blood clot in the blood vessels. Like see this image. So this is the blood vessels, and inside the blood vessels there is a blockages because of some collections of the some blood particles or some unwanted material or some that is called thrombosis. So thrombosis might be like we can see in this image.
Very common in the varicose vein, no, sir?
Yes. Yeah. So we can see thrombosis might be in the legs, thrombosis might be in the brain. In the brain, if it is happening, it's dangerous. So we can see this image. Can you see this image? How this blood clot is blocking the pathway. Okay. So suppose what is thrombosis? The meaning of thrombosis, the collections of the blood cells, and they are occupying lots of area. And after that, sometime some part of this getting breaked, कुछ इसके पार्ट टूट जाते हैं. Some part of the thrombosis are getting breaked and flowing in the blood. We can see these floating part are called embolus. So what is embolus?
It's a floating part.
Floating part. तो पहले ये देखो ब्लड सेल इकट्ठे हुए, अब क्या हुआ कि उसका कुछ पार्ट टूट गया. So embolus means the free floating particle. Okay. So thrombus means a stationary blood clot. एक जगह पर होने वाला blood clot inside the blood vessels. That is thrombus. Okay. And the embolus means moving blood clot, and it will float in the blood vessels with the blood stream, and it might go anywhere. You know, तो कोई भी ऐसा क्लॉट जो फ्लो कर सके उसे बोलते हैं embolus. So why the doctors are, when the doctor putting the injection, first they are taking out, expelling all the air, पूरा इंजेक्शन लगाने के पहले पूरी एयर निकाल देते हैं डॉक्टर. ऐसे एयर निकालते हैं, डॉक्टर्स आर रिमूविंग एयर. Why? Otherwise, that air embolus will float in the blood. That is also embolus. Embolus means free floating particle. It might be just air, and it will float and it will create the problem somewhere. So air bubble in the blood vessels, it will flow through the IV injections, or it will create the problem. So it might be made by blood clot, it might be made by air, right? Or it might be made by many things. Like, okay, so ultimately this is the thing. So sometimes there is a thrombosis in the brain, some blood vessels, then suddenly there is a poor blood supply and person is getting some brain stroke. Okay, so this is the thing, right? So what is the quick treatment doctor giving? Blood thinner. or anticoagulant. The doctor immediately giving blood thinner anticoagulant so that they can dissolve the clot. Okay. So now we are moving ahead. So the question was, now you understood? Which cranial nerve is most commonly affected in the cavernous sinus thrombosis? If there is a thrombosis, if there is a collection of the unwanted blockages in the cavernous sinus, so which nerve is getting affected? So we already have discussed
Septic
third,
and
fourth, fifth, and sixth nerve are closely
6.
related with the cavernous sinus. So in these all the four options, we are having only six nerve. Okay. Question number 3. The superior petrosal sinus connect the cavernous sinus to which structure? What is the answer?
Transfer
Internal
sinus.
jugular.
Transfer sinus.
Transfer sinus. I will show you one image here so that you can memorize what we discussed yesterday. So now we can see in this image here, on the superior part of the brain, this is the superior sagittal sinus. Who is bringing blood from the uppermost part of the brain? This is superior sagittal sinus. Then from the lower part, this is the another venous sinus that is called
Inferior sagittal.
inferior
Sagittal.
sagittal. Okay. Now, one thing I would like to tell you now. So this is the inferior sagittal sinus.
Confluence of
So
sinus.
inferior sagittal sinus is meeting on the confluence, right? Yesterday we discussed meeting on
Yes.
Mhm.
confluence. This is the confluence of sinus, meeting point of sinus. So when the inferior sagittal sinus meeting with the confluence of sinus, so it's this inferior sagittal sinus only till here. Then the connection happening with this structure, this is a very straight structure. So this is called straight sinus. So we can tell inferior sagittal sinus, then straight sinus, then the confluence of sinus. Okay. One more thing I will add here. So inferior sagittal sinus bringing blood from the inferior part of the brain. In between these superior sagittal sinus and the inferior sagittal sinus, in between these two structures, they're a very important part of the brain. We can see this is the front view. So in these two sinus, this is a very important part of the brain. This is called falx cerebri. Remember falx cerebri. We can understand there is some membrane. So I will give you an example here and you will understand. Suppose this is one paper. This is one paper.
बेटा पनीर बना दिया था
हम सब भी खाएंगे पनीर, है ना? सबको भिजवाओ, कोरियर करो पनीर. So this is the falx cerebri, like a membrane. In the upper part, we are having one sinus like this. And in the lower part also, we are having one sinus. And this sinus is, which is the inferior sagittal sinus. Then the last part of this is called a straight sinus. Then they are meeting on the confluence of sinus. Okay. So we can understand in this way. Suppose one coming from top, one coming from bottom, then straight sinus, then confluence of sinus. Okay. Now, look at this image once again. So I will add one more structure so that we can memorize here. Okay. Now from the confluence of the sinus, then we can see there's a right transverse sinus and the left transverse sinus. Right and left transverse sinus. Okay. As per this image, we can see this is collecting the blood from this area. This is collecting blood from this area. Then after that, it becoming S-shaped. This is the sigmoids. Okay. After that, it's becoming S-shaped. So there's a sigmoid sinus that we discussed already, right? So the question was, so I told you of the falx cerebri. Falx cerebri, very important structure, because after understanding this, all the venous supply, then we'll discuss CSF supply, cerebrospinal fluid, then we'll discuss cavity or the ventricles in the brain, then we'll discuss dura mater. So the falx cerebri will come that time during that discussion. One by one, we will be discussing that all thing.
So shall I ask one question, sir?
Yeah.
This fox cerebri, as per the picture you have drawn, it is hanging from the superior sagittal sinus. Is that is joined to both superior and inferior sagittal sinus, sir?
Yeah. So we can consider in that way, the falx cerebri, the structure from the upper part of the falx cerebri, the superior sagittal sinus is passing, and from the lower structure of the falx cerebri, the inferior sagittal sinus is passing. I will show you one image. Let's see. So just if we look at this image, look at this. In this image, if you see the upper, it's written superior sagittal sinus. Then we can see this membranous structure. This is the falx cerebri. Then in the bottom, we can see inferior sagittal sinus. Okay. And the inferior sagittal sinus is becoming straight, that is straight sinus. And all are meeting on the confluence of sinus. Yes. So this membrane is very wonderful. There are two types of membrane here. I will tell you both the types. One membrane is like this. Like this. Because here we are having superior, like I will show you one structure. If we remove this upper part, here. So we can consider the superior sagittal sinus is going like this. Then falx cerebri, then inferior sagittal sinus. Okay. So this membrane is like this. There is another membrane is also like this. One membrane we can tell anterior posterior, one side to side, and these all membrane are interconnected. If we vibrate this, so this will also get vibrate, and if we vibrate this, so this will also vibrate. So this horizontal membrane means if I hold my ear and stretch, then I am stretching my horizontal membrane. That's why stretching the ear is very good treatment. We will discuss, we will stretch the ear in the direction of lips. What are the lips? Lips means LPS. So we'll take the ear laterally, outside, laterally. Then we'll take the ear posteriorly. Posterior means backside. Lips, LPS. Okay, in the lips, forget I. So lateral, posterior, and S means superior. Just hold very gently. If you keep holding the ear in this direction, you will be creating very wonderful vibration in the horizontal membrane. The name of that horizontal membrane is tentorium. It is like a tent, like tentorium cerebelli. So that's why when someone is not doing good, we are doing like this. We are just stimulating the tentorium. Ultimately, whether you stimulate the ear, tentorium, or you fox, they will stimulate each other. All are connected deeply. Okay, fine. So let's come back here on this image. Okay. Let's come back on our quiz. Your question I've answered or not?
Yes, sir. Thank you, sir.
Okay. So it's written, yeah. So I was telling superior petrosal sinus. Okay. So I will tell you quickly about the petrosal sinus also, because in the yesterday class, I discussed only for maybe 2 minutes for this. So let's see, and petrosal. Actually, when we talk about the petro is the word having connection with the temporal bone. Okay, petro is the word. If you're telling the petro means something, some structure having nearby the temporal bone. If you're telling petrosal sinus means bigger veins, some structure near the temporal bone. So let's see now. This is the temporal bone on the side. We know the temporal bone is the bone on the side of ear. If we go on the inner side of the temporal bone, so this is the, we can see superior petrosal sinus. It touching the temporal bone. It touching the temporal bone, the part of temporal bone is called petrous part. So that's why we are telling petrosal sinus. This is the petrous part of temporal bone. So this vein is coming, this is called petrosal sinus. Okay, let's see here, this vein. So yesterday we have discussed about the cavernous sinus. This is the cavernous sinus. Anterior cavernous sinus. Okay, this is the cavernous sinus. Right, left, this entire structure, what we are seeing, this is the cavernous sinus and pituitary gland located here. Now from the cavernous sinus, this is the superior petrosal and lower one is the inferior petrosal. Bringing the blood. The inferior petrosal directly going in the jugular vein, internal jugular vein. But the superior petrosal, superior petrosal is coming in the transverse sinus. Okay. So I will remove this structure. Yeah. So from this structure, cavernous sinus, transverse sinus, the superior petrosal sinus, then the transverse sinus, then this S-shaped structure, sigmoid sinus, then the internal jugular vein. Okay, so there are two routes. One route is like this. and one root directly like this. Okay, there are two roots, superior, inferior. Both are coming from cavernous sinus. So let's see here, quiz. The superior petrosal sinus connect the cavernous sinus to the which structure? So that is the petrosal sinus. Now question number 4. The inferior petrosal sinus directly drain into which vein?
Internal jugular vein.
So that is the internal jugular vein. Question number 5. Which sinus formed S-shaped before emptying into the internal jugular vein?
Sigmoid.
No, it's sigmoid.
Sigmoid.
Sigmoid sinus. We are telling it S-shaped because it's like S-shaped, so we are telling sigmoid sinus. Question number 6. The brachiocephalic vein is formed by the union of which two veins?
Subclavian and interjugular vein.
Subclavian and internal jugular.
C, sir. Superior vena cava and
Superior.
internal jugular vein. C.
So your answer is, I'm asking brachiocephalic vein is formed by
Subclavian and internal jugular vein.
union of, so the answer will be
B.
B. I will show you here.
Subclavian.
C. Hmm.
You can see this image, then you can just develop the imagination, because if you try to just memorize, it will be difficult. Imagination is needed. So you can see here. The right internal jugular vein and the left internal jugular vein. So let's see the right internal jugular. Is it coming down? On the side, this is the subclavian vein bringing blood from the arm. So this internal jugular vein and the subclavian vein uniting together and becoming brachiocephalic vein. Then this brachiocephalic vein is going in the superior vena cava. Yes. So my question was, who formed this brachiocephalic vein? The answer, it is formed by the internal jugular vein coming from the brain and the subclavian vein, right? So the answer will be subclavian vein and the internal jugular vein. Question number 7. Which sinus is not directly connected to the cavernous sinus? Superior,
Transverse sinus.
inferior,
Transverse sinus.
transverse, ophthalmic.
Transverse sinus.
Transverse.
So answer will be the
Transverse.
sinus. So now we can see here. So my question is, we are talking about this cavernous sinus, this entire structure. So first was, it is not connected. So, okay, superior. So this cavernous sinus is definitely connected with the petrosal sinus superior and inferior. Then it's also having connection with the ophthalmic vein coming from the eyes. Okay, so all the ophthalmic vein is coming from the eyes. Then it's so this is the ophthalmic vein coming from the eyes. Then it's going in the cavernous sinus, because right. Fine. So the answer is transverse sinus. Question number 8. The left and right brachiocephalic vein merge to form which structure?
Superior
Superior
vena
vena
cava.
cava.
Superior vena
So they will, yeah, so they will become the superior vena cava. Yes. Question number 9. Which vein provide the main drainage from the brain?
Internal
Internal jugular.
Internal jugular
External
vein.
jugular vein, internal jugular vein, vertebral.
internal jugular vein.
The answer is the
Internal jugular vein.
Yeah, good. Question number 10. Which sinus is located along the falx cerebri, superior part of the brain, and drained into the confluence of sinus?
Superior
Superior
sagittal.
sagittal sinus.
superior sagittal sinus will be the right answer. So it is located on the uppermost part of the brain above the falx cerebri and bringing blood. So let's submit. Okay, perfect. So this was all the right answers. So how many persons having more than like 7 is the right answer? 7 or more than 7? Definitely. I should appreciate if you are having more than 7 answers, right? Because this is the part which is very difficult part of the brain anatomy, but still you are able to understand and you are able to receive this much number, means definitely we will appreciate it. Wonderful.
Thank you, sir.
Yeah. So those who has not appeared or
Thank you.
because of some timing problem and all, they have not seen the recordings or classes. So go through with the recordings. Yesterday we have divided recording in 3 small parts so that you can understand very nicely and appear in the quiz again. Okay, if you have get the mark less than 7, if your right answer is less than 7, like 5, 6 or the 4, then go through with the video and appear in the quiz again. So focus on the today discussion. On the basis of today discussion, we will be giving you quiz maybe tonight or tomorrow. It depends. Okay.
Sir, for this, there is a treatment, sir,
Hmm?
for this blockages.
Yeah,
We have
yes. Yes. Treatment we will discuss very systematically, not randomly. First, we will be discussing anatomy part. Then we'll discuss step by step, like work on the jugular vein, work on this, work on. We'll not discuss randomly, right? We will step by step, we'll do the treatment, each and every, like sigmoid sinus, petrosal sinus, superior inferior petrosal sinus, ophthalmic vein. For every part we have treatment.
sir, little volume, sir. Volume is less.
Okay, volume is less. Okay. Volume. Okay, now it's okay.
Little more, if you.
Hello.
Now
Hello.
correct, sir.
Hello.
Correct.
Now, hello.
It's okay, sir. It's okay.
Hello. 1 minute. Let me check.
Okay, sir. Okay.
Let me check now. Hello. Okay, now. Hello. Okay, so hello. Okay.
Okay, sir. Okay.
So now, look at this brain. And on the backside, we are having confluence of sinus. Then at the level of confluence sinus, you can see this is the back part of the brain or the cerebellum. Cerebellum or the reptile brain or the old brain. Okay. So from the confluence of sinus, the vein who is supplying the cerebellum, the vein who is supplying this occipital part, the name of this is occipital sinus. Okay, now we can see here. Then we are going in the bottom. In the bottom, from the spinal cord is taking exit. This is we can see this is spinal cord taking exit. So at the last of the brain means this is the one more sinus, marginal sinus. Okay, so just I will introduce 2 more sinus here. So if we look at in this image, So we are going on the back side. Exactly where this ending, skull is ending, there is a marginal sinus. And this occiput part is supplied by the occipital sinus. Okay. Now, hold your ear and pull it 2-3 times. Now, going on the back side of the ear in this depression, press this depression. In this depression, if we go little deeper in this depression, are you able to feel this depression on the back side of the ear? In this depression, if we go
Yes, sir.
little deeper, there is a one foramina, there is a one hole, very important hole here, little deeper inside. The name of that hole or the name of this foramina is jugular foramen. Jugular. It's a very important jugular foramen. So now I will show you in this skull. So we know the ear is on this side. This side is the ear. This is the ear. If I go a little deeper, then there is a jugular foramen. So if we see the skull, suppose this is the front side. I'm going here. This is the hole from there. Spine is going out. Spine is taking exit from this hole. Spine. So the bigger hole, the name of this hole is foramen magnum.
Magnum.
Foramen magnum. Foramen magnum means the spinal cord is taking exit. If you see on the both side of the foramen magnum, there is a one hole. Can you see this hole? Is it visible hole?
Yes.
That is a jugular foramen. So if you see here, suppose there is a one structure is going from the jugular foramen. This is one structure because there are three structures passing from the jugular foramen. One artery, one vein, one nerve.
No.
So from this hole, this is the foramen magnum. Just next to foramen magnum, we can see this is the hole. From this hole, one structure is passing. So let's see. Then when this structure is coming down, then we can find this structure if we go deeper from here. Three nerves is taking exit from the foramina, three nerves. 9th, 10th, and 11th cranial nerve. Three nerve taking exit from foramina, ninth nerve. Ninth nerve is the nerve who is connected with this throat area. 10th nerve, biggest nerve, very bigger nerve. The biggest nerve is the bigger nerve who is starting from here, then going in the lungs and heart, right side, even the left side, then going in the diaphragm, then going in the stomach. That is the 10th nerve, 10th cranial nerve. That is also going from this jugular foramen. And the 11th cranial nerve is supplying this neck and shoulder. So 9th, 10th, and 11th. 9th for tongue, throat, speech. 10th, entire body starting from this lung and heart, then the diaphragm, then the stomach. 10th nerve, biggest nerve. and 11th nerve supplying this neck and shoulder. So suppose there is a compression of the near the jugular foramen, or there is a compression of the ninth nerve, person will get the speech problem, throat problem. Vagus nerve is the very bigger nerve. That is called the nerve who relax your heart, who relax your lungs. So the person is having high blood pressure. If we activate the vagus nerve, it will bring the blood pressure down. The person is having high heartbeat. If we activate the vagus nerve, it will calm down the heartbeat. It will relax your breathing. It will relax your beating. It will relax your heart. It will relax your lungs. Vagus nerve. Vagus nerve is going in the stomach, then it will do the very good digestion. Suppose somebody always stressful, on the hurry, curry, burry, then there is a disturbance in the digestion. Then we will activate the jugular foramina. We will activate the vagus nerve. And we will see, wow, digestion improved. Vagus nerve also supplying the reproductive part and maintaining the erection, longer erection. If the vagus nerve is disturbed, person might suffer with the erectile dysfunction. So person is having good erection, good sexual function if calm and relax. If the person in the very hurry, curry, burry, then vagus nerve is not active, inactive. That on the one side we have vagus nerve, and other side we have sympathetic nerve. Sympathetic nerve means with the hurry, curry, burry, tension, anxiety. Vagus nerve is connected with the relaxation, calming effect, relaxation of the heart, relaxation of the stomach, good hunger. Okay. Like we are on the holiday. Holiday means activation of the vagus nerve. We are taking yoga nidra, we are doing yogasana, pranayama, we are just listening the music with our friends, we are dancing, we are enjoying the life. So that is vagus nerve. But we are stressful in the hurry, curry, in the tension, that is sympathetic nerve. The sympathetic nerve activation will create erectile dysfunction. Vagus nerve activation will bring good erection. So starting from the chest, stomach, liver, if vagus nerve is working very nicely, then all the glands will secrete good enzymes. Then we'll able to digest the food. Suppose the food is going in the stomach, stomach will secrete good enzyme. Then small intestine will secrete good enzyme. Liver will secrete good enzyme. So this jugular foramina is very much important. So we have to remember, if the person is having shoulder pain, frozen shoulder, or some compression here, jugular foramina, because that is the 11th cranial nerve. Okay. Or already I discussed about the 9th nerve, that is connected with the speech. So let's see here. The glossopharyngeal nerve is called 9th nerve. Glosso means tongue. Pharyngeal means this pharynx. Okay. It's connected with the swallowing, formation of the saliva. 10th nerve is the biggest nerve. Parasympathetic control, heart, lungs, digestive tract. 11th nerve is accessory nerve. It is having connection with the neck muscles, that is sternocleidomastoid muscle, trapezius muscles, the muscle of the shoulder, and all the three nerve taking exit from the jugular foramen. Very important.